Morning, good afternoon. We'll give folks a few minutes to trickle in and then we'll get started. Thanks for joining today. Good morning, good afternoon, and welcome. Thank you so much for joining us today for Current Evidence and Emerging Frontiers of Mobile Phone Surveys in Low and Middle Income Countries. I am Abigail Greenleaf, and I'm thrilled to be here today to present this paper that I have been working with Charles and Huguette on for the past 2 years. I'm an assistant professor at ICAP at the Millman School of Public Health here at Columbia. And let me walk you through our agenda for today. We're going to have presentations from Charles, myself, and then Huguette, and then plenty of time for Q&A. We are also going to remind you that if you have questions for us, you can put them in the Q&A, and of course, the slides and recording will be available on icap.columbia.edu. I'd like to introduce my colleagues for today, Charles and Huguette. I'll start with Charles, who is the Deputy Global Research Director at Gallup. Before that, Charles was Chief Research Officer at Geopol, and I met him when he was at RTI as Director of International Survey Research Programs. Charles has been publishing and conducting mobile phone surveys in low and middle income country settings for over the past 10 years. Huguette is founder and CEO of the Luminous Agency, where she supports governments and their partners in translating evidence into adoption strategies, capacity building, and country-level implementation. She has served in senior partnership roles for global research initiatives, including Director of Global Partnerships and the Impact for the Global Index on Responsible AI. Her prior leadership with WHO, African Alliance of Digital Health Networks, gives her lots of experience on using new technologies, thinking about equity and how we adopt this work. And we have been collaborating together since 2023. Very excited to have these colleagues with me here today. We are excited to share our findings of a publication that was published in Public Opinion Quarterly in maybe May now. So just to give you a high-level overview before I turn over to Charles, we saw about 2 years ago a need to synthesize the findings of mobile phone surveys. So there had been the last review, I think, was in about 2017. And we are excited about mobile phone surveys, but want the work to be grounded in reality. And so we did this scoping review also because a lot of, and this is a point Charles has made, a lot of US-based research methods are based in methodology journals, but the work in low-income countries is really across disciplines, spanning, agriculture, public health. So it's been hard to know what takes place, and so we wanted to pull it all together. And we'll hear more about the framework that we use, the Total Surveyor framework, but we wanted to know how are mobile phone surveys working in these contexts, and what can we do? What do we know? What do we not know? So we pulled the articles 2 years ago. A lot more has been published in the past 2 years. So looking forward to whoever does the next review. There's been a lot of interesting mortality work, estimating mortality for mobile phone surveys. But we're excited to share what we know so far. Charles will present methods and measurement. I will share results about representation, and Huguette will close out with discussion and next steps. So I'll turn off my camera and turn over to Charles.
Good morning, good afternoon, everyone. My name is Charles Lau, as Abba said, and I'll kind of provide some background about the growth of phone surveys and some of the issues around measurement quality. So, over the last 10 or 15 years, um, phone surveys have really exploded in low and middle income countries. So the acronym that is sometimes used for phone surveys is CADI, or Computer Assisted Telephone Interviewing. Okay. That's just live interviewing with a human interviewer, talking to someone live with a respondent. So, there are a lot of advantages, of course, for using phone surveys. They're faster and cheaper. The first examples of these studies were in early 2010s. So a lot of work happened in the decade of the 2010s, and then COVID, of course, made face-to-face work, infeasible. So it really accelerated adoption. But beyond the cost, kind of time and feasibility, there are a lot of really interesting examples about how phone surveys are sort of add value beyond, those cost and time efficiencies, right? So it's makes survey research possible in conflict-affected areas, hard to reach areas. It enables high frequency monitoring, right? So the World Food Program, for example, does daily phone surveys in a number of countries, and those data are used to update the Hunger Map Live, which is a real-time indicator of food insecurity around the world, right? So that's just one use case for phone surveys that's quite useful. And the core question that our review addresses, right, is when are phone surveys good enough, right? When do they provide accurate, reliable data that we can use, understanding their limitations? Next slide, please. So, as we set off to do the work, one of the first questions we asked ourselves is, well, why don't we just look at the literature from high-income countries and understand how, lessons learned for low and middle-income countries. And of course, that literature from high-income countries helps a little bit, but lessons, don't fully transfer, right? So in a lot of low and middle income countries, countries skipped the landline phase altogether, right? Countries went right to a mobile only era. Um, in most high income countries, we can target phone numbers based on geography. But in most LMICs, we're not able to, sample phone numbers by geography. Coverage gaps appear in high-income countries too, right? People with phone access, are different from those without phone access. But the differences are magnified in a lot of low and middle income countries. And also in a high-income country context, in multilingual countries, typically, it's easier to match an interviewer with a respondent with the same language. In many multilingual low and middle income countries, there's really high linguistic diversity, and that can lead to challenges when you're calling a number that might, be sent anywhere in the country, right? So the design, implementation, the weighting decisions, these all really need to be made on a country and region specific basis. And we can't just take lessons from high-income countries and apply them to LMICs. Next slide. So what we did, as Abba said, we determined that the literature was quite fragmented, right? So we conducted this systematic review to address two questions, right? The first is just descriptive in nature, right? how are phone surveys being used, right? What designs are used? What topics are being studied? And what kind of components from the total survey error framework have been studied? And the second question is more, focused on quality, right? So how good are they, for lack of a better word, phrase, how good are these phone surveys, right? How representative are they? In what ways are they not representative? And what's the quality of measurement that we get from phone surveys? Next slide. So our organizing lens is the total survey error framework. Okay, so consider this a little public service announcement for the TSE framework. Um, and part of our goal in this systematic review is to apply this very useful framework to this problem and it's a way to structure our thinking around quality in phone surveys or really any area of survey research. So really just briefly, the total survey error framework has two branches. Measurement is on the left side and representation is on the right side. Um, so I'll start with the representation. So the representation is all about who we're including in the survey, right? The target population is, the population we want to draw inference to and so with the target population, we access a sampling frame or a list of people that are eligible to participate in the study. Of course, if the sampling frame doesn't represent the target population, that can result in coverage error. Once we go from a sampling frame to a sample, of course, there's a margin of error due to sampling, as we all know. Of course, all the people selected from the sample don't participate in the survey, so that can result in non-response error. And then there can be adjustment error as we kind of use weighting. Weighting is never perfect, right? To adjust for coverage or non-response. On the measurement side, this is more about, what we're asking. You can think about it, think about the questionnaire, okay? So, thinking about the construct, this is like the thing we want to measure. That's an abstract kind of theoretical concept. And then we have to go and write survey questions, right? That interviewers ask and then respondents answer. So the gap between sort of the ideal construct and the measurement is about validity. And then measurement error can creep in too, right? If people don't understand the question and they need clarification or they just take a shortcut, that can result in measurement error from the respondent and also the interviewer side. And then there can be processing error. So all these things, these various sources of, error can contribute to errors in the ultimate survey statistic that we're looking at. So if that's a very brief tour through the TSE framework, and hopefully you can take that away to apply to your other projects as well. And there's a citation here from Groves and Liebberg and Public Opinion Quarterly in 2010. Next slide. So I'll go through this quickly. We did the scoping review. We looked for a bunch of databases and using standard methods, and we included 38 manuscripts in the review across 21 low and middle income countries. Next slide. So here is a plot of the number of articles in our scoping review over time, and it reflects the growth of phone surveys and LMICs. Of course, there's a quite severe lag in public and actual implementation and publication, and these numbers that we know have grown over time, especially in the last 2 years. Next slide. Most of the studies are from Africa and Asia, right? So about two-thirds were from Africa, about a third were from South or Southeast Asia. There were a few in Latin America, just one in the Middle East. Most were from the public health community. So people attending this seminar may be, familiar with or even authors of some of these studies. Um, there are a number of studies from the economic development field, especially from kind of development economists who work in socioeconomics or agriculture and technology. It was a mix of designs. So about, just under half were random digit dial phone surveys, right? That's where we randomly generate phone numbers in the country based on knowledge of how phone numbers are assigned and then call them up afterwards. Um, on a cross-sectional basis, right? Like a one-time basis. The others are face-to-face follow-up surveys. So we conduct a face-to-face survey and then we follow up that we get their phone numbers, permission to recontact, and then call them back afterwards. Um, there are, quite a big range for interview length, and most surveys use an incentive. Next slide. Okay, so I'll go through the results of measurement first. First, we'll start with the good news. Our paper has a lot of rich detail about each individual paper. Here, we're just going to provide the headlines. And the good news is when we think about what types of things we can measure well in a survey questions that use yes/no responses about straightforward behaviors or events show really strong reliability, right? There was one paper in Mali that looked at monitoring for community health program aspects, and they use yes/no questions. Another article asked compared a face-to-face and CADI survey to look at a measles vaccine in Cameroon, and there were really high levels of agreement. Do you have you received the measles vaccine? Yes, no. Type question works quite well in a phone survey. Also, there was a study in two studies, one in Lebanon and another in Tanzania and Bangladesh, where phone surveys ask about alcohol consumption, tobacco consumption, whether a healthcare professional has diagnosed you with diabetes. These are all yes/no questions, and they're relatively straightforward behaviors and experiences. And here, there are really high levels of reliability. So, we ask one time, and then the researchers ask the same question again later, and there are very high levels of agreement or reliability over time. So these questions work quite well in a phone survey. Next slide. Okay, yeah, here we go. Okay. There are some high risk measurement areas though for CADI. Okay. So please be aware, if you're commissioning a CADI survey or if you're consuming, an article that, was used with CADI, we recommend looking out and to understand the quality of measurement here. So one project, Anderson et al. Compared a face-to-face and a phone survey, and they asked about crop production estimates. Okay, so these are numeric questions, right? Like how many fava beans did you grow in your field in the last season, kind of questions. Okay, and here we found that the face-to-face survey produced significantly lower crop production estimates compared to CADI. And some of these were quite large, up to 68% difference, okay? So there are a number of other articles in the review too, but numeric questions are always hard for people in any survey, and especially for CADI. Knowledge questions were also somewhat complicated. There's one study in India, and also proxy reports. So proxy reports are when, we um, ask people about someone else's behavior or attitudes. And here we found, more inconsistent data about adverse birth outcomes when we asked someone other than the mother. Next slide. So one key question, that often gets asked when we, do phone surveys is how long can these surveys be, right? There's a lot of anecdotal evidence and intuition and sort of rules of thumb that are used. There's a little bit from the literature. And the take-home message is that the optimal questionnaire length really depends on the complexity of questions, right? So there was one article in Malawi where they randomized people to receive a 10, 20, or 30-minute questionnaire, okay? And then they compared the same module across the different question lengths, right? So this is a nice experimental design to look at how does the questionnaire length, the placement of that module, affect the data. And really, the data quality indicators and the response distributions were really the same, right? This was an article about parental survival. So, are your parents alive or not? Yes, no. So again, a very simple, straightforward question. It's a salient topic, of course, for people. So this worked quite well. On the other hand, there's a contrasting example from Ethiopia where they randomized the placement of a nutrition module, okay? And these nutrition modules the questions were quite complicated, right? It was like, what kind of food did you eat and how much? And basically, there were a lot of fatigue effects, right? People got tired of answering these questions later in the survey, okay? So really, there's not one answer about like how long a questionnaire should be. If your questions at the end of the interview are quite simple, I would say you can go up to 20, 30 minutes. but you want to, minimize any questions about that complicated subject matter with numeric responses or cognitively burdensome questions towards the end of a phone survey. So here's some just really simple, principles about implementer checklist from both from the literature, but also the three of our experience of doing phone surveys, right? So all survey questions generally need to be, very simple and pared down. This is especially true with phone surveys. Keep in mind that cultural context, people are multitasking, they're oftentimes working, taking care of children, doing other activities during phone surveys. So you need to keep the sort of respondent perspective in mind. Be really cautious, about, complex construct, long recall periods. It's one thing when you're sitting in front of your Microsoft Word document, drafting questions, but that's where it's important to always, test in the context with real world people using cognitive testing or other methods as well. So, and then there's different ways of validating, but really the best thing to do is to test your questionnaire, in the context to understand how well people perceive and understand the items and are able to answer them. Next slide. Over to you, Abba.
Thanks so much, Charles. And I'm going to now discuss representation and what we learned about how researchers seek to ensure their samples are representative as possible. I'll quickly show the total survey error framework again. You can see I'm on the right side, and I'll walk you through each aspect of representation, both the design portions and then the error portions. So one of the first findings from the 38 articles we included in this review was that these mobile phone surveys, and again, we only included mobile phone survey articles that had an aspect of analyzing sources for error. So there are a lot of mobile phone surveys out there that just present results, but the articles we included had to actually talk about some portion of error. So there's 38 that we included, most of which were at the national level. And then when it wasn't looking at the general population, women were the most frequent target population. So we wanted to think about who can you actually reach when you're doing a mobile phone survey. So this image is not from our paper. It's from a 2023 article by Al-Kasabi about who owns mobile phones. This is using DHS data, and it illustrates the considerable variation in mobile phone ownership across countries. We see Mongolia at the top, 96% phone ownership. Central African Republic down at 28% at the bottom with, quite a bit of variation in between. So these differences matter because they directly affect who can be reached through a mobile phone survey. Countries with lower levels of phone ownership are going to face greater risks of coverage error. Again, coverage error is the difference between your target population and your sample frame. I think understanding these patterns and who owns a mobile phone survey in your target population is a really critical first step in assessing whether or not a mobile phone survey is an appropriate data collection strategy and who may be systematically excluded from participation. So because our scoping review focused on primary research, coverage error, a lot of it is analyzed using existing data sources and not actually conducting mobile phone surveys. We didn't include a lot of articles. They didn't meet our inclusion criteria. But when they did, we saw that, the issue is under coverage. That means that not enough people own mobile phone surveys compared to who is in your target population. So the differences between mobile phone owners are that, men are more likely to own a mobile phone than women, generally, urban residents more so than rural residents, those with higher education, those who are wealthier. So these are privileged populations that have mobile phones. And again, the differences differ quite a bit by country context. But it's important to know that going in. So taking the time to look at who owns a mobile phone from existing data sources is quite important. And when your coverage error is quite large, weighting might not fix the full outcome, the bias that exists. So it's important to think about, and we can't tell you an exact number to quantify, but thinking about how much, coverage error is too much. As Charles mentioned, random digit dial is randomly creating phone numbers. That is a very popular way to sample folks using mobile phone surveys. The other way is to follow up with people from a previous in-person survey. And the follow-up that we were able to see range from 2 weeks to up to 19 months later. And I'll show a graph shortly that kind of graphs the time between follow-up and response rate, and it's mixed results. So the two main approaches are RDD and face-to-face follow-up, but we actually found, I think it was 8 other ways to sample people. And there was some really interesting creative approaches. And I think that this is a really valuable finding from the paper, because funding for face-to-face surveys has decreased, so there may be less opportunity to follow up that way, but there are really ingenious ways. So I can't walk through all of them, but basically we found 2 approaches to kind of using community-based sampling. So in Cameroon, researchers worked through community health workers in the extreme north, where it was unsafe for outsiders to go door to door. So they had 30 villages. It was a 2-stage sample. Local community health workers collected phone numbers in the selected villages, and then 19 were selected from each of them. Ultimately, the response rate was about 65%, so that ended up working pretty well. In Sudan, this was a mobile phone survey about cook stove usage. Colleagues worked through local chiefs, although that was in more of an IDP, internally displaced persons camp, so a little bit of a more defined geography. So those are 2 examples of community-based sampling. In India, women who were at a health facility were asked to participate in a study, which I think if you have some sort of outcome that you want to follow over time, that's again a great way to enroll people. A couple of examples, one in Myanmar, one in India, of following up people from previous cell phone surveys. A lot of companies that do cell phone surveys will ask at the end of a previous survey, would you be willing to be contacted for another survey, so they can then use those people and they already have information about who they are. And then a couple examples of previous census being available for sampling, and then from an evaluation, a program implementers offering the sample frame. So again, if you don't think RDD or face-to-face follow-up are possible in your context, take a look at these examples of people have creatively sampled participants. So this is the graph that I was talking about, that on the x-axis shows the number of months since the face-to-face survey, and on the y-axis the response rate. And it's almost a U-shaped pattern. You do see the highest response rate was just a couple of months, 4 months in Uganda after the face-to-face survey. These again are only the face-to-face surveys we included in the study. So it can help to follow up more quickly, but we don't see a totally linear pattern. It was difficult to draw broad conclusions about non-response, which is the next type of error. Again, non-response has to do with, once you have created your sample, who in that sample responds and who doesn't respond. There's often kind of 3 main causes of non-response, and the main cause of non-response in LMIC mobile phone surveys is non-contact. That is, people just like not picking up. We don't see very high refusal rates. Once people get on the phone, they're usually pretty willing to participate. We do see that face-to-face follow-up has higher response rates, ranging from 50% to 93%. Whereas RDD is lower. And again, that's because you're usually just creating a phone number, some of which do exist and don't exist for the RDD. So we did find, another finding is that we found substantial variation in how response rates were calculated and reported. So a recommendation we have from the review is to adopt standard disposition codes. The American Association for Public Opinion Research, APOR, has a document called Standard Definitions that will tell you how to categorize participants and how to calculate response rates, cooperation rates. And that would just make it a lot easier to make comparisons, because right now response rates are, comparing apples and oranges because there are different people in the denominators and numerators than, or it's just not clear at all who is in there. We had non-response discussed in only 9 of the articles, so less than a third. And again, non-contact was usually the main cause of non-response. We do see that respondents appear willing to engage across a variety of topics. So we think that there's, generally goodwill towards mobile phone surveys in LMIC settings. The challenge is just getting people on the phone. So, the first challenge being, do people own a phone? And if they do, getting a hold of them. There's usually, pretty good enrollment rate once people are on the phone. So I'm moving now to post-survey adjustments, which is weighting. And this was a particularly interesting area. Took me some time to work through this section of the paper and write it. We spent quite a bit of time discussing it and how to really summarize it. So 14 articles mentioned using survey weights, but only 9 kind of explicitly evaluated whether weighting actually reduced error or improved representativeness. Just because you create weights doesn't mean that the bias has been addressed. In many studies, researchers weighted their samples so that key demographic characteristics like age, sex, education match those of the target population. But in several cases, the survey estimates remained well outside, reasonable confidence intervals when compared with benchmark data sources, suggesting that weighting was unable to fully correct for error or bias. So, one interpretation of that is that weighting can only do so much when, you have really severe coverage error. If certain groups are just systematically missing, even with adjusting with weights, you can't fully address the omission of that population. We did see considerable variation in weighting approaches. You'll see the first bullet on the slide. We have post-stratification, ranking, propensity score matching, calibration, and entropy as approaches to weighting. It was hard to draw conclusions about what works best because no articles used multiple approaches to weighting. It was, again, comparing across articles, across, phone ownership contexts, across, subject matters. So hard to fully draw a conclusion. But it shows that you can't immediately just assume that your weights are going to solve your problem, because many times those who wrote the paper were able to successfully weight the data in terms of matching the sociodemographics in the phone survey with the census or a reference survey, but then the outcome, again, was really outside of a reasonable range. Overall, the evidence suggested that weighting tended to perform better in middle-income countries, where mobile phone ownership is generally higher and coverage gaps are smaller, but that literature is relatively limited. So again, a key takeaway is to view weighting not as a complete solution to representativeness, but a tool that is important and still requires a lot of comparison to a reference standard. So one of my last slides is taking a look at the representation of mobile phone survey samples compared to the census or a reference standard overall. While we wanted to be able to, disentangle each source of error in articles, oftentimes articles weren't able to say, well, this is a difference because of coverage error, this is a difference because of non-response, or because of sampling. So we got a lot of, here's the overall difference between one population and another. So we decided to share that overall. And one of the findings was that kind of random digit dial more so than the face-to-face follow-up underrepresents disadvantages groups. So we have some examples of underrepresentation that takes place. There's a more expansive table in the article that has all the articles that have, for example, low-income persons underrepresented. So we do see differences in who is represented in the work, and unfortunately, it's often the groups that we're trying to reach as a public health practitioner. These are the folks that we are interested in serving. And so again, thinking about in your context, who can you reach and who can you not reach? So my summary slide before I hand it over to Huguette is, again, thinking about how to be creative with your sampling. If random digit dial or face-to-face follow-up doesn't work, take a look at that. I think it's table 2 in the Public Opinion Quarterly article. There are also some other creative approaches that we saw, such as passing the phone to someone else. So most often, if you're doing random digit dial, a man will pick up. Can you pass the phone to someone else that may not have a phone? Can you pass the phone to a woman? That worked with mixed results. The details are in the paper. Also, some folks reported out about how to call, what time of day, but that is very country specific. And then finally, more details about the weighting. I think in particular, an article from Myanmar gave really detailed explanations of how they created their weights, and that's always appreciated. So in summary, the representation in mobile phone surveys is varied. In some places it's doing well, other places it's not doing as well. But again, if you think about not just trying to do nationally representative samples, you may be able to get a more representative snapshot of your target population, but so far, target population being overall country population is what we have seen. Let me pass over to Huguette for discussion.
Thank you, Abba. I'm having some issues with the connectivity, it seems. So my camera will come on at some point. But just to bring us towards the end of this, of course, discussing when are CADI fit for purpose and when are they not. So when we're talking about fit for purpose, we really mean, whether the method matches the questions being asked and the conditions in which the work is being done, and the conditions that determine where a lot of data collection is taking place shifted significantly, primarily last year. And that changes have really raised the stake for a lot of teams. To me, the new development that have occurred in this moment provide also an opportunity. Yes, we're dealing with an environment where a lot of aid has been decreased. So much of the work that we've been talking about and the examples that Abba provided in her presentations were funded with aid funding. And so there's a lot less of that recently. And I think there's some surveys that are forecasting in global health, especially US, which funded a lot of health programs, their funding is decreasing in about half. So for teams that are, especially in low and middle income or resource constrained settings, they're having to make a lot of choices. And for some of them, it could mean, do we go ahead and conduct a survey, or do we leave that? Is that one of the really critical aspects of our work? Again, so as with the funding decreasing, face-to-face that require a lot more investment in terms of funding, as that's becoming more difficult, the low cost component of CADI and the speed of it can really support filling in the gap. Another development that I think we need to look at this point, at this juncture, is the development around benchmarking. In health systems, for example, for decades, there was the Demographic and Health Survey Program, the DHS, that was the standard. So face-to-face surveying and feedback capturing methods were the standards. It's how we measured everything else, including the validity of mobile data. But that program paused in March, so leaving space for something else. Some of the gap that he left has been filled with philanthropic funding, etc. But again, the optimist in me sees this disruption as an opening for those of us, a lot of us who are on this call, a chance to rebuild the system that can be country-led, that can be considerate of the various factors that we face in our development work, whether it's health, education, livelihood programs, etc., and get us closer and closer to a more equitable space. And as we've heard, one of the implications of this review is that the total error survey discipline, so the practice of accounting for explicitly and for every source of error in the data, has become very, very valuable, especially as the field is rebuilding the infrastructure that we use to validate the data. So with the benchmarking component changing and us looking to see what other methods can we use to capture feedback, to evaluate the data we capture, there is an opportunity here to really rebuild that system so that it's not just something waiting for when we have more funding, but it's really something built to sustain and survive in different conditions. And so still in the yes, thank you, Abba, for changing the slides. So there are really three lessons I wanted to draw from, especially a lot of it from my own experience, but also from the research conducted, looking into covering various systems, from education to livelihood programs, and even global health. Basically looking at where digital tools have been introduced at scale. And the first lesson, especially touching on the equities, extended coverage. And as Abba mentioned, is something that has to be built. We've learned by the design. We know that the coverage gaps are in mobile data are not random. Oftentimes they mirror the exclusions documented in various fields, especially when it comes to education, access to technology, digital finance, etc. And the most people who are missed, as Abba mentioned, are rural residents, low-income households, people in different age groups, and then also gender, and in a lot of LMICs, women. And if we continue to advance by focusing on only reaching those who are easy to reach, we know that our samples are being tilted and our results are a bit skewed. And so a stronger approach really would involve mapping those likely exclusions as we're designing our surveys whenever possible. We can do things like planning for oversampling. As Abba talked about, sometimes people are passing the phones to different respondents, including that as we're planning to ensure that we're designing our work to anticipate and address any of these potential gaps. The second lesson is really connecting service to shared infrastructure. For many places, being able to do this work is a luxury. We heard examples of the various approaches used in different places in Sudan, etc., community-based data collection methods, just to ensure that we can be as inclusive as possible. Those doing things that way, connecting to an existing pipeline of access to people being impacted by the work that we're doing, and collecting data that way, and integrating it into a already existing system is a strong method. It not only allows us to collect more data, but also allows us to be able to triangulate various types of information so that our results fit into a context, and the insights we gain from those results are able to help us address actual problems and not just serve as research. The third lesson that I'd like to share here is we focus a lot on frequency when it comes to data collection. Of course, we want information, and the more feedback we have, the more data we have, we feel, the more we know. But we found one thing I'd like us to consider is the idea that these insights have to really connect to a specific decision. If they don't connect to a specific decision, if we're doing it for research purposes, they do serve a purpose, but whether those the results we receive are leveraged to improve a situation very much depends on where those insights are fit into everyday decision making. So a lot of my work with policymakers really focus on that understanding, not necessarily skewing surveys or research to respond to their questions, but ensuring that the results as presented address actual issues that they're trying to address, and that those insights serve to move them, provide more information, connect them to the populations they serve. We know that remains a gap for a lot of decision making. So again, rather than as we're planning our work to try to pay attention and notice, is there anything that we're discovering that could speak to decisions that are being made and that impact the same populations that we survey. Next slide, please. And so that brings us to an attempt at suggesting and recommending a path forward. There are several emerging tools that are expanding this toolkit. We heard a bit about voice agents that can now administer structured interviews and at near human quality on closed items if we program them correctly. And so that is helping. Of course, it's in areas with connectivity, but it's helping ease a bit the need for large field survey teams. In places, one of the key issues around digital inclusion, access on both ways for users and for researcher is language. And so oftentimes, especially in LMICs, our research is limited to the use of the business language, English, French, Spanish, Portuguese, Arabic. We don't go into local languages. So real-time, the ability to translate our questions real-time and the responses real-time are also supporting us in expanding our reach. And then automated monitoring systems can support in some of what Abba mentioned earlier around where are the people we're serving, how are they feeling, at what point, what time of day is best for them. It will detect fatigue, whether the responses are being rushed because it's just not the right time, or there's a lot more happening. And then in help interviewers essentially address or try to sort of shift their approach to ensure that they're getting as close to quality responses as possible in real time. So it's a really fast moving area, and much of what is described here is, may eventually become routine. Of course, it's going to take time. So the real time translation for people like myself who are working with capital cities and rural areas, of course, we want these to become reality right away. But I know that they face the same constraints I spoke about earlier. The fact that there's still a need for coverage, there's still a need for digital education to really be able to bring as many people into the fold as possible. One important caveat I wanted to also address here as we're returning to the opening questions is, what I just talked about is that yes, CADI can support in as filling a gap where costs may become an issue, but we have to remember that the access or the ability to use these technologies itself, they don't expand coverage, and there's still a need as we're working on leveraging these tools as they become available to not, this is more of my call to action, to not lose sight of the fact that people still need access to mobile phones. They still need access to the tools that allow them to contribute to this work. And as researchers are becoming more and more comfortable in utilizing these tools, not to forget that those who we are collaborating with, those who we're collecting the data from, may still need us to sort of coach them through this process, so clarify our questions, build trust so that they're able to answer questions truthfully, and that the technology can improve the existing work, but it's moving faster than the users are moving along. So as researchers, I feel we still have the responsibility to be able to really bring people forward. And so just to close us out, there are a few commitments that we wanted to put forward to the people here and to those who are able to access this work. First is to remember to, as much as possible, to really anchor this work into country ownership if we're working internationally, and ensure that the national capacity is there. And we consider there's a lot of discussion around data ownership that are taking place, data sovereignty at the global scale in any field, health, education, climate, etc. And those are considerations that we have to take into we need to take into account as we're designing our work. And then the second consideration is being able to design, whenever possible, hybrid. So easing into the use of CADI. There are still places where face-to-face will be a requirement if we truly want to get feedback from people. It could be in conflict areas. It could be especially around vulnerable communities, to ensure that the transfer to CADI isn't so rapid that it leaves people behind, and that we take into consideration those aspects. And the third is just making transparency a standard. What methods are we using? What styles of serving are we using? What are the limitations? What are we facing? So that as more of us learn from each other, we're avoiding any unnecessary hurdles, and we're learning from the lessons for those who have tried it before us, even if they didn't necessarily reach their objective. And then the last is just to reinvest in the benchmark. We know that some of the systems that we've relied on may not be possible anymore, or they may not be possible to really scale this approach to research. And so what other viable methods for benchmarks could we invest in, and perhaps provide some options so that we can expand access to research, access to insights, to more and more people, and expand this community. And so this is where, just to wrap up, is that CADI are options and they're viable options, but in order for them to really serve and for us to get as much as we can out of this approach, there are these foundational components around equity, around inclusion, around access that we cannot ignore as we shift our attention towards the use of technology. Okay, I'll stop here, hand it back to you, Abba. Thank you.
Thanks so much, Huguette and Charles, and we'll take the last few minutes for some Q&A. And I see that there is one question in the chat. I wonder, Charles, if, oh, great, you already answered it. Okay, great. Well, efficient. Thank you so much. Thank you. So while we're waiting to see if any other questions come in, I'll start with a question for you, Charles. What would you like to see studied next, or what do you think is one of the more pressing topics to understand more about mobile phone surveys?
I would say I would emphasize a theme that you and Huguette both mentioned about the need to figure out creative ways to include underrepresented populations. So it's one thing to look at, a slide and say, less educated people are less likely to be represented in phone surveys, but that has huge implications for the value of phone surveys and policy or programmatic applications of the data. So some of the approaches, like where you mentioned, Abba, where people are calling a phone number and then asking to hand off to a woman or someone without a phone, or seem to be promising approaches. And it'd be nice to see more examples of that in the literature, because as you said, these are populations that we want to reach most.
Yeah. Thanks, Charles. And I'll add to that. I think the proxy report is really interesting, seeing how we can expand the sample size, how effective it is to ask someone simple questions about another household member. Jessica, it looks like you have a question.
Yeah, great. Hi, thank you so much. Really, really great webinar. Two related questions, perhaps. I see that the face-to-face interview is being held up as the gold standard. But what if the telephone interview is actually better? Do you have a way looking at that? Because I perhaps I misunderstood, but it seemed to me like the assumption was face-to-face was the gold standard. Secondly, what about CASI, computer-assisted self-interview, which can be done, by having an audio-assisted element to it, so you're not dependent on, people's literacy, but it still takes the interviewer out of the middle there, and at least for sort of more sensitive questions, is often thought of as leading to more reliable information. Just interested in your thoughts on both of those topics. Thanks.
Thanks, Jessica. I can start with the Cassie question and then pass it over to Charles and Huguette in the last minute. I think there was some interest in Cassie more so in like 10 or 15 years ago. I know there were some articles out of Zimbabwe about the audio assisted interviews. We don't see a lot of that currently, I don't think. But I think that could be an interesting comparison to the mobile phone survey, because there is a level of anonymity in the mobile phone surveys that may allow people to disclose. I did a phone survey in Eswatini. We asked a lot of sensitive questions, and people were willing to share sensitive information about sexual behavior, about their relationships. So it could be interesting to compare mobile phone surveys with Cassie to take out that difference of interviewer effects. I don't know, Charles or Huguette, if you have any comments, particularly on Jessica's first question about face-to-face surveys as the standard.
I think what I would say, agreeing with Ava in terms of literature and some observation from doing field work, data collection, face-to-face versus distance, whether it's phone, etc. Depending on where it's being done, I think some parts of the world, people have a level of comfort with speaking with anonymously. And then there are parts, I see there are some colleagues from the DRC on the call, maybe they would agree, that's where I'm from. There is not as much level of comfort in speaking with an unknown receiver of information. And so in those places, so my in asking what could be interesting to look at would be sort of, for Africa, the eastern and southern parts are very much used to contributions and survey, etc. And then on the central and northern, especially the francophone and lusophone, it's a bit of a different culture. So my interest would be in sort of looking at how these have performed. I mean, this is fancy and wishing, that the research gets there somehow, and just to see how this difference in comfort with using technology, etc., how it may impact this type of work. But yeah, over to you.
Thank you. I do want to be cognizant of the time. It is already 10 a.m. Eastern, so I think we will need to wrap up here. I want to remind you the webinar recording will be available online, and we are very excited about a Grand Rounds next Tuesday. That's the 23rd, about the current Ebola outbreak and seeing what is going on there. So more details are forthcoming. Thank you again to my co-panelists, Charles and Huguette, for joining, and thank you all for being here today. Thank you so much, and take care. Bye-bye.